Hey, thank you for coming today. My name is Dr. Chill, and today I will be giving you a full cranial nerve exam. So, these cranial nerve exams are a great way of me being able to check the general state of your health and your well-being. Is this your first cranial nerve exam? Okay. That's okay. Well, it's great that you come for your first one today. I promise to make this as relaxing and as calming for you. There's absolutely nothing to be worried or concerned about, okay? Great. So, this cranial nerve exam is going to be split up into 3 different parts. First off, I'll be checking your eyes. I've got a number of tests lined up just to get a good gauge on how well your eyes respond to certain movements and light sources, okay? Secondly, I will be checking your sense of smell. So pretty self-explanatory really. Again, I've got a couple tests lined up just to test your sense of smell and how well your nose responds to them. And finally, I'll be checking your hearing and your ears. So again, I've got a number of tests lined up just to do that, okay? So, I want you to relax and be as calm as possible for this. I promise to be gentle, and if you're ever uncomfortable at any point in this exam, then please just let me know, okay? Great. So let's jump right into this exam then. First off, before we begin actually, I just need to check your heart and your lungs, okay? So I just need you to take a couple deep breaths with me just to get your oxygen flowing, okay? Good. Okay, now I want you to take a deep breath in. Yep, that's it, just in like this. And out through your mouth, that's it. In through your nose and out through your mouth. Okay, let's do it. Perfect. Okay, is it alright if I just put this over your lungs and your heart? Great, thank you. I'll just warm it up a bit, it's a bit cold. Okay. So just try and stay as still as possible for this. It shouldn't be uncomfortable for you. Okay. Now I'm just going to check your lungs first, okay? Just down there. Okay. And the other side. Perfect. Now I'm just going to check your pulse, so stay still again, please. Just that's it. Just take a okay. That's it. Just relax. Okay. Perfect. Everything sounds absolutely fine. I'm just going to take a few notes throughout this exam just for my own reference, okay? BPMs, perfect. Just BPM. Lungs, absolutely fine. Begin the examination. Great. Okay, so as I was saying earlier, I'm going to start off this exam by first just checking your eyes. The first test I want us to do is I'm going to just place my finger in front of your face like this. While keeping your head still, I just need you to track where my finger goes with just your eyes, okay? Okay, so I just need you to keep your eyes focused on my finger. I'm going to go to the left first. Okay. Okay, let's go out wide. And back inside. Out wide. And back inside again. Okay. Same again, but going the other way this time. Okay, out wide. And back inside. And out wide. And back inside. Perfect. Okay. Now, while keeping just one eye closed, I want you to use your eye just to track, to tell me how many fingers I'm holding up. So first off, I'm just going to do it from your left eye. So please just close your right eye. That's it. Just like so. Okay, just keep that closed. Now I just need you to tell me how many fingers I'm holding up, okay? Perfect. Okay, so just keep your right eye closed. Okay, let's do it now. Correct. 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 Okay. Same again, but keeping your other eye closed now. Okay, just keep that left eye closed, and let's begin. Correct. 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 Perfect. Okay. So, your eyes seem to respond very well to those exercises, which is very good. Very good start to the exam. Okay, now I have a bit of a new test I like doing on my patients now. This is just to check how well your cranial nerve responds. So I am just going to be very gently just touching you just above each eye with this Q-tip. Now, it actually feels quite relaxing just touching it there. So, there's nothing to be concerned about here. When I touch you just above each eye, I need you, after I say so, just to look up, just using your eyes towards the Q-tip, okay? Just tracking how many times you blink while doing this. So, okay, just keep your head very still for this one. I'm just going to put this Q-tip just above your left eye. Okay. Now look up, please. Okay. Perfect. And look back down. And same again. Just look up, please. And let that down. Great. Okay, now same again, but with your other eye. I'm just going to put this Q-tip just above it. Okay, so just above it there. Now look up and back down. Okay. Now look up and back down. Perfect. Okay, now I'm going to be using this medical light just to have a bit of a visual inspection of your eyes. I don't anticipate this to be uncomfortable for you. The light is quite a dim light, so it shouldn't be too harsh on your eyes. But if at any point you don't enjoy this light or find it uncomfortable, then please let me know, okay? Put some gloves on for this. You don't mind if I just touch just very gently around your eyes, do you? Okay, just so I've got your consent for this, that's absolutely fine. Put my first glove on. So how are you finding this exam so far? Is it relaxing for you? That's good, that's what I like to hear. I like to try and make my cranial nerve exams as calming and as relaxing for my patients as possible, because no one likes going to the doctors, do they? I have to admit, your eyes seem absolutely exceptional so far. You could be a pilot with those eyes. I'd say you have 25/25 vision, not 20/20. Okay. Perfect. Okay. Now, just want you to track this light just very slowly for me, please. I'm just going to get up a bit close, and I just need you to follow where the beam of light goes. So I'm just going to go this way first. Okay. Back in the center. Back out wide. And back in the center. That's it. Back out to the other side. That's it. Into the center. And back out wide. That's it. Gonna get a bit closer up here, just take a quick look around just to see how your eyes respond with this light close up. Okay, this side. Okay, perfect. Up. Okay. That's it. Okay. Okay. Ideal. Everything seems absolutely perfect so far. Thank you for being so still for that. Okay, let's take my gloves off, and next we're going to do some smell tests. I'm going to go through those very briefly with you, okay? quickly note down the eye test. So, yeah, absolutely perfect so far. Every test was great. Yeah. Should be a pilot. Definitely should be a pilot. And ideal. So, next off, I'm going to be testing your smell. So, for this test, I have 3 different foods just below me. All these 3 foods are fruit, so you should be quite familiar with the smells. So if you can smell it correctly, then you should be able to guess what fruit it is. So it's just a very good basic test. Okay, so first off, I'm going to be using this fruit here. So if you want to keep your eyes completely shut for this one, I'm just going to raise this fruit very slowly just towards your nose, okay? And I'll tell you when to breathe in. Okay, so it's just below your nose now. So if you want to take a bit of a sniff in, that's it. Okay, don't worry, I promise you it's fruit. Okay, now I'm going to take that down. Okay, so what fruit did you think that was? Correct, that was an orange. Very good start. So a lot of these fruits are quite basic, but this is quite a basic test just to see how well you respond to this one. Okay, so the next fruit is coming up towards your nose now. So again, just keep those eyes closed, please. That's it. Okay, it's going up towards your nose now. That's it, take it in. Bit of a harder one, to be fair, this one. Okay, so what did you think that was? Correct, Amondo. 2 out of 2. Smashing it. Okay, now the final fruit is another household favourite. So you should be able to guess it, judging by your reaction to the first 2. So just keep those eyes shut, please. That's it. Okay, so up it goes. Okay, that's it. Okay, take it all in. That's it. Good deep breath in. That's perfect. Okay, so what did you think that fruit was? Nope, it wasn't a beetroot. Nope, it was a banana. I'm quite surprised by that guess, but oh, you were joking with me. You knew it was banana. Okay, funny man. Okay, no worries. I'll give you a 3 out of 3. Perfect. So the next test is slightly similar to the first one. In this, I've got 3 of these little bottles of different smells, and these smells are going to be a bit more harder to guess. They're still smells you probably encounter on a weekly basis, so you should know what they are if you can smell it correctly. So for this test, I just need you, while I'm moving this up to your right nostril, then your left nostril, I need you to hold the opposite one, press it down towards your nostril like that. So and then take a bit of a sniff in, okay? You need to quite take it in quite a lot because it's quite hard to get the scent out of a bottle, okay? So, now, you can keep your eyes open for this one if you want. First smell is coming up towards your nostril now, just your right one, so please just keep your left nostril squeezed in like that, that's it, and take a sniff in, that's it. Same again, but your other nostril, that's it. Perfect. So what did you think that smell was? Correct, it was lavender. Okay. Okay, so the next smell, another little bottle. So again, I just need you to do the same thing again, just taking a big sniff in from each nostril. Okay, so just... Okay. Take that in, okay, take a sniff in. That's it. Okay, now same again, your other nostril. Take a sniff in. Great. Can you guess what that smell was? Yes, it was indeed rosemary. Another good guess. Okay. Okay, now the final bottle contains another unique smell. Can you guess what it is? Let's find out. Just keep your nose, that's it, perfect. Take a sniff in. Okay, do the same again for your other nostril. Great. Okay. Can you guess? Oh, quick. Yeah, it was lemon. It was lemon indeed. Very good guess. So again, absolutely perfect. You can see why I enjoy the smell test the most. Quite a unique thing to experience of the doctors, having an apple shoved up against your nose. But it's an important part of the cranial nerve exam, so... Okay. So I can safely say that your sense of smell and the state of your nose is a perfect again, absolutely perfect. Okay, so the final test is a hearing test, as I said earlier. So I have a couple tests planned for this. I just need you to relax again, take a few deep breaths if you need, and I'll continue on with this exam. Okay, so the first hearing test is quite an interesting one. What I'm going to do is say a couple, well, probably about 4 different phrases to each ear individually. I'm going to start by saying these phrases at a higher volume, then slowly work my way down to a more inaudible kind of volume. I just need you to tell me when I ask you if you can hear and repeat the word that I've said to you, or phrase. Is that okay? Okay. So I'm going to start off on your right ear. I'm going to say one phrase and we'll go on from there, okay? Okay. Butternut cupcake. Okay. That's correct. Butternut cupcake. Okay, I'm going to do the same again, but on your left ear this time. Lingering discontent. Correct. Lingering discontent was the second word I used there. Okay. Okay, now I'm going to do the same thing again, but I'm going to just lower volume and repeat this phrase a couple times, okay? Just so you can definitely hear what I'm saying. Okay. Sparkling pineapple. Sparkling pineapple. Sparkling pineapple. Okay, you didn't quite get that. I'll do the same phrase but on your left ear this time, okay? Sparkling pineapple. Sparkling pineapple. Sparkling pineapple. Okay, you got it that time. Yes, it was sparkling pineapple. Bit of a random one, I'm not gonna lie, but it was a good answer. Okay, the next phrase is a bit of a longer one, so just keep those ears tuned to what I'm saying to you, okay? Helpless doctor is here to help. 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 Yep, that's correct. Helpless doctor is here to help. Obviously, I'm not talking about myself, but it's just a phrase, okay? Just a bit of a joke. Perfect. Well, you responded pretty well to those to that hearing test there. The next one I've got in store for you is a slightly similar one, but instead of saying phrases into each ear, I'm going to be tapping a random number of times to each ear. All I need you to do is repeat back to me how many times I've tapped this little black box, okay? Just a random black box, nothing to it, just here to tap away to you from ear to ear, okay? So, just need to, that's it. I'm going to start off by doing it next to your right ear, so just repeat back to me how many times I've tapped the box. Okay. Correct. 3 on each ear. Correct. Now again, I'm just going to go in a bit closer, but a bit quieter, so... Yes, correct. 5 to each ear. Now I'm going to up the intensity of this a bit, so I need you to keep your brain switched on for this one. Okay. Okay. Okay, great. It was 8 times to each side. Great. Now, because you responded so well to that test, I'm just gonna, this isn't so much a test, more just see how well you can hear this box going binaurally around your ears. So just out of 10, please just tell me how well you can hear this box. Be honest and truthful with me. Okay. Okay, so with 10 being you can hear it perfectly and 1 being you can't hear it at all, how well did you hear that box? Okay, about a 6. That's pretty good, above average then. I'm going to do this a bit more quieter now, so again, just focus in on the box. Okay, so just relax. Okay. So how well did you hear the box then? Still quite well, about a 5. That's good. Most of our patients rate a bit lower than that for that kind of volume, so it shows that your ears and your hearing are in a very good shape, which is good. Okay, now finally, I'm just going to have a visual inspection of your ears. I'm going to put on some gloves for this one. I hope you don't mind me just touching around your ears. Is that okay? It shouldn't be uncomfortable for you. Great, so put these gloves on. Okay. So do you think you'll be coming back for a cranial nerve exam anytime soon? Okay. That's good. Like I said, it's kind of good to go for an exam like this, probably like once a year if you can. Obviously I know it's hard to find the time and sometimes motivation to come, but it is a very good way of just checking that everything is up to scratch. And obviously it's very nice to see you in person as well. Have a little chat. And okay, I'm struggling to put these gloves on, so this is embarrassing. I'm a doctor, I should be able to put gloves on. Okay. They are on. That was impressive. Okay. So, I'm just going to end on this now. So I'm going to have a quick look on each ear and just around it and see if I can see any signs of any problems or anything we should be concerned about. Okay, so just relax. Okay, just relax. Okay. Okay, just check your other ear. Great, well, everything seems in order, in good condition, and all I can do is thank you for coming today. You were a very good patient and I thoroughly enjoyed my time with you today. So, just going to finish up my notes. Hearing and your ears are great, your sense of smell is impeccable, and you could probably be a pilot with your vision. So I hope all these compliments aren't just unfounded to you, and I hope you go home today very happy. Okay, well, it was very good to see you, like I said, and I hope to see you again very soon. Have a good night. See ya.